APhA-ASP Webinar Week. Tonight's webinar will focus on the position of Patient Care Vice President. My name is Scott Brewster, and I'm one of your APhA-ASP National Members at Large. My email will be provided at the conclusion of the presentation, and as well as those who are presenting tonight. I ask that at the conclusion of the presentation, if you have any questions, or throughout the year if you have any questions, feel free to email myself or my committee members on the Member Engagement Standing Committee. Now, just for some housekeeping items, everyone is currently listed in a listen-only mode. You may listen in via phone or computer, and if you choose to do phone, you'll have an email with the telephone and the access code there. To be respectful for others, please mute yourself until you are ready to ask a question at the end. During the webinar tonight, you can text your questions in and we will follow up with those at the end, or at the end you can use the raised hand icon to let an organizer know, and we can unmute you and you can ask your question. So to get us started, I'd like to start with a poll just to see who we have on the call tonight. So what is your role in your APhA-ASP chapter? As expected, we have quite a few patient care vice presidents, but we also have presidents, patient care committee members, so I think this webinar will be great for everyone, not just our patient care vice presidents, but how we can all impact patient care in some way or another. So our agenda for tonight, we want to cover the APhA-ASP patient care projects and programs, our patient care vice president roles and responsibilities, the resources for patient care vice presidents, reporting and awards, and tips and tricks to the trade. So let's get started with our APhA-ASP projects and programs. Really focusing on why we do projects and programs comes back to our APhA theme for the year. Kelsey Gallego's presidential theme, Together We Can. And obviously with patient care vice presidents, we really focus on the why for why we do our operations and programs. To focus with student pharmacists on collaborating and connecting, developing those clinical skills and opportunities for professional development and speaking, applying that knowledge and advocating through our work, but also ultimately advancing patient care, reaching our patients, like I said, through our projects and programs. So we're going to go ahead and jump in to each of our patient care projects and programs with our community outreach programs first. Our newest one being over-the-counter medicine safety. Started in 2015, it's supported by McNeil Consumer Healthcare and Scholastic. But really what this program does, it focuses on educating those 5th and 6th grade students. We recognize through research that at around 11 years old, students and young adults are starting to self-medicate. And this is a vulnerable age that we want to focus on educating how to read a label, properly measuring, the spoon versus a measuring device, storing medications, but also working with parents for these young adults to educate them, focusing on the safe use of medication. We realize this is a new program that maybe some of your chapters haven't started that you're interested in starting. And I would encourage you to email myself, one of my community members, Amanda Diopstroff, who you'll hear from tonight, or any of the Member Engagement Standing Committee members to figure out ways that maybe you can implement this program at your chapter level. Near and dear to my heart and popular for most chapters is Generation RX. Generation RX focuses on educating the general public on the safe uses of prescription drugs. Really focusing on those potential dangers for misusing and abusing prescription drugs. Sponsored by Cardinal Health Foundation and The Ohio State University, This program, like OTC Medicine Safety, can really be used for our first, second, third, and final year students that maybe not necessarily have the clinical knowledge or feel comfortable with an Operation Diabetes or Operation Heart that we'll talk about later, but want to get out and want to be involved through a project or a program to educate those and help their community. This is something that we focus, like I said, on enhancing medication safety, but also through prescription drug takebacks, educational programs for young adults, really working on ways to safely use medications. Now we're going to talk about our patient care projects. Our first being Operation Immunization. It's our oldest patient care project and it's sponsored by Albertsons Safeway Pharmacy. But really our goal for Operation Immunization is to raise public awareness about the importance of immunizations. Many of you may know this, but August is Immunization Awareness Month, and it could be a great way to campaign for immunization awareness. For student pharmacists, it varies through states whether student pharmacists are able to vaccinate or not, but I would encourage you to be aware of that, being able to go out and vaccinate yourselves. Even if you can't, being able to go out and educate on the importance of vaccines, being able to give them, but also being able to advocate for why patients should pursue vaccinations. Next, we'll talk about Operation Heart, sponsored by Walgreens. The goal of Operation Heart is to educate and empower patients to take care of those cardiovascular risks. And that can be done many ways, through blood pressure screenings, cholesterol screenings, but also through tobacco cessation, because we know of the effects of tobacco use on cardiovascular outcomes. Diet and lifestyle modifications as well. As you can see here from the picture, it's a great campaign for RED. One thing that my chapter has done in the past is Red Dress event for raising awareness for women's health and cardiovascular outcomes. So it's something that could be fun, obviously in RED. Next, we'll talk about Operation Diabetes. Operation Diabetes focuses on raising awareness and the education of the prevention and control of diabetes. Very similar to Operation Heart, it can be done through screening of patients, whether it be blood glucose screenings or A1C screenings, but also to helping the patient along the way through education classes, helping them to realize what those numbers may mean, and talking to them about the complications of diabetes. So focusing on the education we can provide for them, not only through screenings, but also long-term, because we realize this is a chronic disease. And the supporter of Operation Diabetes is Rite Aid. So now that we've talked about the patient care projects and programs, I just want to come back to this home slide and talk about our patient care vice president roles and responsibilities. We're going to talk about familiarity of resources, organization, communication. This is a big part of patient care vice president. It's not just for the communication vice president, but as a patient care vice president, you have a huge role in communications. Developing relationships, documenting and reporting, and then the recruitment of your members who will execute your events. So just want to start with familiarity. It's really crucial for patient care vice presidents to have that general knowledge of APhA-ASP and really to know that the resources available to you so you can help student pharmacists in patient care projects, but also in their membership. Focusing on going to pharmacist.com, chapter cookbook where you can find new innovative ideas for patient care opportunities, planning guides, reporting guidelines for the times when reporting comes around, and throughout the year when you keep up the chronological list. Meetings, working with your advisors is crucial to have preceptors at events, planning events, making sure that you're reaching the public in the best way. And also going up the ladder, working with your regional officers, my committee, the Member Engagement Standing Committee, and also the National Executive Committee. One thing I would also like to point out is it's really crucial for all chapter members, especially the patient care vice presidents, to realize and utilize the communication style guide to being able to communicate with the general public versus talking about a P1 student, rather talking about a student pharmacist, so that we continue to have the same messaging, the same branding, and that we can be a reliable source in the community. We'll talk about that a little bit later. Now I'd like to turn it over to Amanda Diostroff, a member of a member of the Member Engagement Standing Committee, to talk about utilizing resources.
Hi everyone, thank you for having me tonight. Now that Scott has provided a great introduction, I'm going to start by diving a little bit deeper into the resources available to you and your chapter. So hopefully you all have visited pharmacist.com before, but if you have not, we're going to show you how to access all of the resources that you will need. First, you should start by going to pharmacist.com/APhA-ASP, and from that page is where you can access a lot of information. The first that we're going to be talking about is you can scroll down to the bottom of that page and it will say APhA-ASP Projects and Programs. After clicking on that, it will bring you to this page. And from here, you will select from the patient care projects and community outreach programs listed. Once you have clicked on a particular project or program, you can read through the overview as well as some statistics about the project or program as well as its history. Underneath that, your screen should look like this. The image on your screen is the planning guide for Operation Diabetes. These planning guides are updated by the Member Engagement Standing Committee each year so that they contain the most up-to-date information that can be useful to you and yours. Starting off in the overview section, it gives you an introduction to the project. Underneath that, you can find information for your chapter advisors as well as an education section that's especially helpful for your first-year student pharmacists. But it can be a good refresher for some of your more experienced student pharmacists too. For example, this one is for Operation Diabetes and goes over diagnostic criteria, dietary guidelines, risk factors, and more. These resources will make your chapter members feel more prepared to volunteer at an event. If you look below the overview, under Resources, you can find steps and tips for planning an event. Here you can also find how to promote events to the public and through the media. There are tips here for how to write a public service announcement, a pitch letter, and how to be interviewed by a reporter. There are sample documents here that you can model your own promotional materials after, so you don't have to write from scratch. You can also find forms for documenting event information, which would be very useful for the reporting process, as well as patient forms that are useful to take to screening events. Under the support tools, there's a wealth of information related to therapeutics, supplies, and guidelines. These are all resources available to you, but you're also welcome to come up with your own resources, and we really encourage that. We want you to feel free to get creative, so please take time to look through these on your own time, and also make sure that your project leaders are also aware of these resources. If you look down a little bit further, under online resources, you can find links to websites that will supplement the planning guide here. For example, on this screen you can see links to the American Diabetes Association, as well as others. Even further down, you can see the reporting guidelines. These are created for each individual patient care project and community outreach program, and these are separate from your Chapter Achievement Award report guidelines. Jordan will go into these a little bit more in depth later in the webinar. If you go back to the original screen and now click on Chapter Officer Resources, you will bring up this next page. Under Chapter Operations, you can see the Communication Style Guide, which Scott mentioned earlier. Under this, you will find out how to refer to different things within APhA-ASP, such as how we always use the term student pharmacist and never use the word pharmacy student. Please make sure that you read through this as you proceed to plan for your upcoming year. Hopefully you all have the opportunity to attend your mid-year regional meeting this year. This is the only meeting that's designed specifically for student pharmacists. At MRM, you have the opportunity to attend the Chapter Leadership Workshop. Also, there are workshops for Generation RX and OTC Medicine Safety, which are opportunities for you and your chapter members to learn more about these programs and how to advance what you're doing at your chapter. This meeting is a place to network with student pharmacists in your region, share ideas, and bring those new ideas home to implement at your chapter. This is also a great meeting for first-year student pharmacists to learn more about APhA-ASP. And at MRM 2016, there will be an interest table available specifically for first-time attendees. The annual meeting next year is going to be in March in San Francisco, California. You can look forward to specific patient care project workshops. These workshops are 1-hour workshops where you can discuss specifics for each patient care project and community outreach program, such as innovative ideas, potential collaborations, and you'll have the opportunity to network with chapter leaders and members nationwide, not just in your region. I encourage you to make sure that you have a representative from your chapter at each workshop. Also at annual meeting, there are workshops available for each chapter leadership position. So for you guys, you can look forward to the Patient Care Vice President workshop where you or your incoming Patient Care Vice President can meet and network with other Patient Care Vice Presidents. There you will learn more about the position and new resources available to you. As leaders within APhA-ASP, you should be aware of the communication avenues that exist. First, we have social media. If you have not already, make sure that you like or follow us on Facebook, Twitter, and Instagram. Through these, you'll be able to keep up to date with important dates and deadlines, pharmacy-related current events, and highlights from chapters across the country. You will definitely stay really connected if you follow us on social media. As members of APhA-ASP, you are all subscribed to Student Pharmacist Magazine. This is another great opportunity to see what other chapters are doing, read articles written by student pharmacists, new practitioners, and pharmacists. So look out for these in the mail. Our final method of communication is through Student Pharmacist Connection, which will be sent to your email inboxes. This is a monthly email that highlights timely announcements, highlights student pharmacists and chapter advisors who are making a great impact in their communities. It will have a section to provide information specifically targeted towards the needs of your final year student pharmacists, and much more. Make sure that your chapter members are aware of these great resources. We look forward to reading and hearing all about your successes this year. And now I will go ahead and turn it over to Jordan Long, who is also a member of the Member Engagement Standing Committee from Cedarville University.
What's going on, everybody? Like Amanda said, my name is Jordan Long. I'm a final year student pharmacist at Cedarville University School of Pharmacy in Ohio, and I'm also a member of the Member Engagement Standing Committee. So tonight I'm going to go over the roles and responsibilities a little more in depth. Scott started us out, but I want to go a little more into detail, and then as well I want to talk about the awards process a little bit, which I know you will all be interested in as patient care vice presidents. So first off, going a little more in depth to your roles and responsibilities. When it comes to the organization, you want to make sure that you have a good selection in programs. We understand that not everyone has the resources to do every patient care project at one time. That's okay. We encourage you to focus on quality of the programs over quantity. In this arena, less can be more. I'm not saying that you should get rid of every project you have except one, but get one project up and running smoothly. And when you do this, consider the interests of your chapter members and the needs of your communities. And then, as you get those projects up and running, you can start tacking on other projects and focusing on others. The next is committee structure. Your committee structure is very important to your success. The organization in your committee will determine how much you can achieve in the upcoming year. I would highly suggest considering having uniformity between the different committees. This will help you organize and manage these committees as you're trying to juggle between the different operations. And then moving on to logistics. Logistics are absolutely essential. You want to make sure that your chairs know and have what they need to set up events and advertising for events. Also, be sure to advertise your events to ensure a successful turnout for the hard work that you put in. Utilize Facebook, listservs, and word of mouth to get the word out about your events. The next responsibility is recruitment. So first, find ways to excite everyone to get involved. Make sure events are meaningful and fun and really draw in student members. When it comes to chairs, think of how you would tackle a project if you are given very detailed instructions versus when you are given leeway. When you are given ownership of a project, you tend to give it your all. You want to motivate your chairs to run with their ideas and be innovative. This is where they will thrive. Understand your members' comfort levels. Some will be more comfortable in larger groups and some will be more comfortable in one-on-one patient interactions. You want to make sure that you have a variety of events to hit up all the different comfort levels and get all your members involved. Levels of knowledge is also important. Obviously, your first year and final year student pharmacists are going to have a different knowledge base, and you want to make sure you appeal to all members. For first year student pharmacists, make sure you involve them in more educational events. For your final year student pharmacists, more service-related events might be more appropriate. And regarding levels of leadership, grow your talents of your involved members and target them for future project leadership. This is an important succession planning. Offer opportunities to take their involvement to the next level and get the first years involved early, and they will help with the continuity of your events. This is also a great opportunity to delegate some of that work as well. Finally, appeal all to your members' interests. If you have someone that has an idea, see if you can make it happen. When someone has a passion behind what they are doing, let them take ownership of it. This will really encourage innovation and allow your members to get more involved. Moving on to relationships. It is also so important to maintain those relationships that you are constantly developing while you're doing your patient care projects. Make sure that you reach out to those contacts, including chapter members, pharmacy organizations, pharmacists, alumni, faculty and staff, and some other examples. These people want to help you out with some of your events. You just have to ask them. They may help you build relationships with other members in the community as well, expanding your opportunities. Remember, think all your involved people that you get involved with. This will help maintain those relationships as well. For example, within your schools of pharmacy, you might see that you have a nursing organization or a physical therapy organization. Collaboration is awesome, and we are always trying to collaborate with other professions. Make sure to work with other organizations and find out ways that it can help both parties be involved. These relationships should always be a win-win. Now moving into a little different subject, let's talk about awards. There are two separate cycles for the awards. The Patient Care Project Award reporting cycle is July 1st through June 30th of each year, and the reporting deadline is July 15th. It is important to remember that these reports are separate from the chapter achievement reports. All patient care projects and community outreach programs have their own reports. There will be 8 regional winners recognized at their respective MRMs per patient care project and community outreach program, and 1 national winner recognized at APhA annual meeting and exposition. The only exception is Generation RX, which has a reporting cycle that is a little different because the top 3 winning chapters send representatives to the APhA Institute on Alcoholism and Drug Dependencies, which is held each year in Salt Lake City, Utah. The reporting deadline for Generation RX is January 5th. The 8 regional winners are recognized at the APhA annual meeting and exposition. So now that we went over the awards, let's talk about the awards criteria, because there are several things that we are looking for specifically in your awards. First, collaboration. This is with other organizations in your community, on campus, and with other healthcare professionals. We really want to get you more involved with collaborating within pharmacy and with other healthcare professionals. Number 2 is participation. Always ask these questions. How many student pharmacists are participating in your events? Are the same few people attending all of your events, or are you really looking to engage all of your members? How many faculty and staff, new practitioners, and pharmacists are coming to your events? These questions are what the reviewers will ask themselves as they're looking at your reports. And again, this all comes down to having good relationships. Third is originality. We really love to see how you put your own spin on the patient care projects and community outreach programs. For those who feel like they have an excellent reign on all the current APhA-ASP nationally promoted programs, this might even include developing a new program at the chapter level. We love to see you use that creativity and innovation that you all love to use. Last but not least is outcomes. How many patients are you reaching, and how are you showing them what pharmacists and student pharmacists can do for them? But always remember that quantity over quality. We really want to see you guys have quality events with collaboration, participation, originality, and outcome as the focuses. With awards comes reporting. This can be a daunting task, so have a system in place as you enter the school year. Some chapters use paper slips to record their information, some use Google Drive to keep everything centralized. There's no gold standard for this process, but find what works for your chapter and team. The most important part is that once you choose a process, hold people accountable to it. As part of your process, I encourage you to have a plan and record your progress as you go. This will keep you on task throughout the year, and I promise it will make things very easy when you have to write all your reports at the end of the school year. And with that, I will hand it off to our next presenter, Nicole Clay. Nicole?
Hi everyone, I'm Nicole and I'm a final year student pharmacist at the University of Cincinnati. And just like all of you, I was very passionate about patient care, which is why I wanted to become more involved. And I actually started out as a self-care committee member, for those of you who remember Operation Self-Care. From then, I went on to be the self-care chair, and then finally, I was our most recent patient care vice president. And I just want to say I think it's great that we have so many different leadership roles here, and I think that all of you will find something beneficial from these few pointers that I'm going to talk to you about. So I've got these 10 pointers for you, and they're just to give you some ideas about programming and organization to help you with your patient care involvement. First of all, let's start then with number one. So, how creative can you be? Well, there really is no limit to your creativity for yourself as a patient care VP, even committee members, chairs. With how innovative you can be, there is an award that Jordan mentioned called the Innovation Award. And, it's what kinds of things can you do? So just for an example, Pacific University developed an app for immunizations. At Cincinnati, we have an entire operation dedicated to sun safety and melanoma awareness. And a great resource to check out is Student Pharmacist Magazine. And if you saw the most recent issue, you would have seen that there is a women's health operation at Stanford and a men's health operation at Florida. So these are just kind of like ideas to throw out there that, just because we have certain operations doesn't mean you can't do more. So there are areas that student pharmacists we're just beginning to touch in the healthcare, and you can help push that box. On to number two, you need to work great with your chairs. They and their committee members, those are the real workhorses of the patient care arm of your chapter. And, whether it's giving them chocolate or a pep talk, it's really important that you watch that they aren't getting overwhelmed. They have all the supplies that they need. So just remember you need to work really well with them. So which leads us into 3, that it is crucial that you communicate well with others, meaning that you need to be available for comments and questions, whether they are from the rest of the executive committee, your advisor, maybe between patient care chairs or others outside of your chapter. Organization and communication may be the 2 most important skills that a patient care VP needs to be effective in their role, as you'll be dealing with many different personalities to reach your aim, which is ultimately great patient care. So remember, together we can. And knowing where to find and directing help with others is something that you need to be aware of by the time that you are the patient care VP. So whether it's your advisor or knowing how to find preceptors for an event, this is really the responsibility of the patient care VP. So organization is really important for locating those resources. And also along those lines, you hopefully have a new practitioner or mentor. So what can your new practitioner help you out with your chapter? So 5 and 6 kind of go together. It is very important that you stay excited and passionate about patient care. You will need to know how great, you will need to show other people just, how great APhA-ASP is to get people to join and members to go to your events. So how are you going to do this? Well, you can literally bring out those pom-poms for a tailgating event, or you can just show it through your personality and your excitement. And you're not just going to be a cheerleader for your organization. You're going to be a cheerleader for your patients and ultimately your profession just with your enthusiasm. And then on to number 7. So number 7 is something that I always told my chairs all the time. If you didn't document it, it didn't happen. So however you have your system of documenting, just make sure everybody stays up on it. This is where your superhuman organizational skills are going to be important. It will help out immensely at the end of the year for reporting, but also along this lines goes social media. So make sure that you are putting those events on Facebook, Twitter, Instagram, so that you can be showcased nationally for all your hard work. So with the next pointer, you know, take the summer if you can, if your school allows it, to plan as many events with your patient care chairs as you can, because by the time that school starts, you don't want to be trying to plan an event and also trying to study for that therapeutics exam at the same time. So just make sure you use your breaks as effectively as you can to get all of your work done, just to save you your own peace of mind. Then we move on to collaborating. That's a great way to expand the work that you do as a student pharmacist. So whether it's with your college's medical school, other pharmacy organizations, community partners, or even other pharmacy schools in your region, there are so many opportunities for you. For example, I know that the University of Kentucky and Sullivan got together to do a joint Operation Diabetes, Operation Heart event in northern Kentucky. So, you know, just because you're in one location doesn't mean you can't go to others. And then finally, make sure you have fun. For the patient care VPs on the line, I can say that this will be one of the most rewarding leadership positions that you will have while you're in pharmacy school. So just remember, this year, you want to remember why it is that you wanted to do this, and it's going to remind you why you wanted to be a pharmacist, why you went to pharmacy school, and you will have a great time serving your patients. So thank you for the opportunity to talk to all of you today, and now back with Scott.
Thank you, Nicole. Just to recap what we've covered tonight, we've covered the APhA patient care projects and community outreach programs, really focusing on our theme, Together We Can, because together we can accomplish great things. We've also covered the roles and responsibilities, really getting familiar with our patient care projects and programs, staying organized, and really focusing on motivating and communicating effectively throughout the year. Utilizing our resources, keeping our connections, focusing on our APhA-ASP resources found on pharmacist.com, including our Member Engagement Standing Committee. And we've talked about reporting and awards, focusing on streamlining the process so that we can be aware of the different deadlines of patient care projects. Now I just want to focus on some highlights and some opportunities. So student outreach. Each fall, the APhA-ASP National Executive Committee and APhA student development staff conduct APhA student outreach visits to chapters around the nation. APhA-ASP utilizes APhA student outreach programs not only as an opportunity to visit the schools and colleges of pharmacy, but as a chance to learn more about each chapter's activities and how APhA can assist chapter leaders in having a successful year. What this can mean for your chapters is where we can offer feedback for chapter programs, gain insight on your initiatives, and for patient care vice presidents, work with you and your chair members to help implement those patient care projects like OTC medicine safety. They might just be starting. Teleconference options are available, but for more information, I would refer you to this link at the bottom so you can sign up and have a student outreach visit at your chapter. So stay connected. Staying connected is a big part throughout the year for APhA. You can follow us on Twitter, watch us on YouTube where you can find not only this webinar, but all the other webinars we've had throughout the week. Follow us on Instagram and like us on Facebook. As Amanda mentioned before, here are our dates for the mid-year regional meetings. I'll pause for a minute so you can write these down. But mid-year regional meetings are not only great for patient care vice presidents, but all chapter members. Registration is $125, and the deadline is 2 weeks prior to event start. I would encourage you to work with your chairs, work with your committee members to get people signed up before then. Registration is open now, and I know for my region, Region 3, it sells out much quicker than 2 weeks prior. So the earlier you can sign up, the better. Some more information on MidYear Regional Meeting. At MRM, we can really see the policy proposal work and policy proposal process work. And for that, there's a lead up for the proposed resolution webinars conducted by the regional delegates where each chapter can talk about the submitted chapter proposals. At MidYear Regional Meeting, there's also a roundtable invitation proposal process where you can showcase your innovative, successful, and unique programming at your chapter level, patient care related or not. And if you're interested in running for a regional office, I would encourage you to do so. You can serve your profession and your region. Talk to APHA student developmental staff, National Executive Committee, regional officers, or a member of the Member Engagement Standing Committee. An exciting thing is FarmFlix. This year the theme is Together We Can. And really with FarmFlix we're focusing on this public service announcement. It's focused around 90 seconds or less. It could be a commercial, movie previews, and it's divided into 3 categories. Informative, and our deadline for chapter submission is December 1st. Now I'd like to open the floor for questions. You can submit those or you can use the raise hand function.
We currently don't have any questions from anybody, so if anybody would like to take a moment to type in your question, please go ahead and do so or raise your hand and we'll be happy to unmute you so you can ask your question. It looks like we do have a question, and this is from Diana. And she would like to know, can you please tell us which web page to check for resources again for patient care vice presidents?
Okay, so I talked about resources, so I can answer this question for you. We kind of talked about 2 buckets there. First, we talked about how to find the resources specifically for the different projects and programs. And then we also talked about specific resources that kind of talk about how you can operate your chapter, where we mentioned the communication style guide. But all of those have links that you can access from pharmacist.com/APHA-ASP. So you should be able to launch to all of those different pages from that initial page. But if you have any questions about specific resources, I'd be happy to answer one for those too.
Thank you very much, Amanda. We do have a question for, it looks like Laren, who is an inaugural patient care vice president at a new school. What recommendations would you all have for a newer school? And it looks like they currently have 5 projects up and running, but what recommendations would you have in terms of ensuring success of projects and programs, or even, offering recommendations for the number of projects and programs a new school should be running?
Sure, I'll go ahead and kind of answer that, and I'll definitely leave it up to Amanda, Bethany, or Scott to kind of tack on as well. But I came from a newer school pharmacy as well. I was a president, so I was not a patient care vice president. But what I always found to work was really focusing on 1 or 2 different patient care projects at a time and kind of building those up. I think the struggle is that when you try to take on 5 projects at a time, it's hard to get your processes all down and really secure how you're going to run each project each year. So for a newer school pharmacy, it might be easier to kind of invest in the long term and try to focus on that 1 to 2 projects a year until you get to a point where you have a good handle on one and then move on to the next one.
I would also say that we just added the position of Patient Care Vice President to my chapter last year. And at UNC, we have had a strong, large chapter for a long time, and it was just a matter of we needed to adjust our structure to match the APhA-ASP recommended structure. So we really worked closely with our chapter advisor, who had a little bit of background of how our chapter was built and the best way to utilize that role. And the chapter president and the chapter president-elect and the patient care vice president all worked very closely in order to help kind of divvy out what distinguished roles and responsibilities were for each one of those positions, and that patient care vice president worked really closely with all of those project leaders. So I would just encourage you to utilize those other leadership roles as well as your chapter advisor, and just you can decide what works best for you and your chapter, because that's really what's going to make it most effective.
And also to follow up with that, one thing I think you mentioned in your question was ensuring the success in the future. Maintaining, like Jordan and Amanda talked about, those connections is huge and crucial. Focusing on being able to have a streamlined process so that if you see a successful event, what went into that event to make it successful? Developing those connections with a community member, working with your advisor to say, how can we repeat this going forward? I think it's a great place to start because you want to continue those successful projects and programs and build upon those.
Thank you, everyone. We do have another question, and Scott, this one might be geared a little bit more toward you since it is in regard to Generation RX. Nina has a question. She says she lives in a city with a huge drug problem. Can Generation RX be implemented in general drug awareness, including illicit drugs such as methamphetamine, heroin, and more? Or does APhA recommend restricting this program for just prescription drugs?
That's a great question. And I would definitely say it's much more than just prescription drugs. We recognize that prescription drugs in many ways can be a lead-in for abusing illicit drugs. So it's much more than just prescription drugs. It's educating on drug abuse, alcoholism even, and addiction of any kind. So working with those patients who are at risk for abusing any substance, working with them and talking to them about those things that maybe if they have a heroin problem, if they're a recovering heroin addict, that they can know, they can communicate better with their doctor because of an interaction with you to say, hey, I'm in recovery, and you can give them the tools and abilities to say, you know, when they go to have a prescription, they might not get an opiate the next time because that could put them at a risk for a rebound or a going back into an addiction. So definitely much more than just prescription drug abuse. It can be expanded even further. Hope that answers your question. Thank you again for everyone for joining us tonight. I hope you were able to enjoy the program, but also gain some information. I would encourage you to follow up with us via email if you have any further questions. Also, if you would like to revisit this webinar, it can be found on our YouTube page. But once again, thank you guys and have a great night.